Good evening. Welcome to IOSH UAE Branch. I think we got over 160 participants for the webinar at the moment and over 500 plus registered. We are all going through COVID-19. The pandemic really shattered many opportunities for all the working sectors. Eventually, we are arising from the pandemic, and IOSH UAE would like to bring to you Mr. Antony Green from WSP, who is the Operations Director of WSP in Middle East. He's also part of executive leadership team, both in Middle East and India. Antony Green is associated with WSP, which is one of the leading service providers. And he would be going through the business continuity and during the pandemic. Any Q&A you would be having during the slides, please use the Q&A the box, and Antony Green would be more than happy to assist you with. Antony Green, now the podium is all yours.
Thanks, Deepak, and thanks for the introduction. Hopefully you can all see my screen today. Firstly, thank you to IOSH for having me today. It's a pleasure to be able to talk to so many health and safety professionals at one time. As Deepak mentioned, I've been with WSP for 21 years now, both in the UK and in the Middle East. My current role as Operations Director for the region means I have a broad responsibility for day-to-day business activities, so particularly key when we're talking about business continuity. I'm also the HSE representative for the leadership team. In the Middle East, we have just over 2,000 employees, primarily spread between UAE, KSA and Qatar, but we also have a presence in Kuwait, Oman and Jordan. So we have a lot of people to support and protect. WSP is part of a wider global organisation of just over 50,000 professionals based out of Montreal and across 500 offices globally. So primarily offering professional engineering and consultancy services to the built and natural environments. So today's topic, as you can see, is business continuity. Now, I don't profess to be a subject matter expert in business continuity management. There's far more qualified people to talk about the exact topic. However, as a business leader, what I can do is talk about what we've done as a business, and during COVID, how we've managed to implement some of that and deal with the pandemic as we've gone through it. And perhaps give you some examples also of things that you might be able to implement in your teams, in your projects, or in your businesses. So what is business continuity? Business continuity is about having a plan and a system in place to deal with a major unplanned disaster or event. In WSP, we have many people to protect, as we talk about, as I mentioned, our people, our clients, contractors on projects. We also have tangible assets. And even though we're a professional services business where our primary asset is our people, we also, if you're in manufacturing or heavy industrial, then you would also have, maybe a lot more tangible assets to protect. Also, WSP is a public listed company. So we have a duty for our shareholders to protect their investments and the interests of that. So we actually, for us, it's a non-negotiable that business continuity needs to be managed. Business continuity is also not new. Every team has been having contingency plans in place for years to deal with. If we take IT, IT is a good example where for the last 20 years, what happens if a server goes down? What happens if the internet goes down? What happens if our email server goes down? So we've always had small contingency plans in place around the business. I would say the thing that's slightly different with business continuity is we bring it up a level from functional level up to business level. And therefore it's a plan that's owned by the leaders of the business who are accountable for the business operations. And it's really focused on risks that have a material impact to the overall business. So there's many ways to design a crisis management plan. There's many different models you can use around change management. around continuous improvement. The one that we've chosen to use internally is the plan, do, check, act model, which is an iterative process that goes around. So in the planning stage, if we talk about business continuity, we're doing business impact assessments, we're taking a risk-based approach, and we're gathering all the information. In the doing stage is there where we start developing the crisis management plan. We then have to check it, review it, and test it. And then the acting is then implementing it and being ready for it. So what is WSP's approach so far to business continuity? And let me give you a bit of background, just going back a few years. So in 2017, with the Qatar embargo, where the Saudi-led coalition severed diplomatic ties with Qatar, we found ourselves in a position in our structure where we felt that this could be a cause for a crisis in our business. Fortunately for us, it didn't last too long. Qatar managed to find additional ways to reintroduce a different supply chain from where that had broken. You know, the disruption of flights going in and out, we were able to manage it through going from Oman and Kuwait. So whilst it's a bit of an inconvenience and there was some impact, actually we managed to maintain our way of working through the whole of this crisis. But it was a bit of a wake-up call. We certainly wasn't as prepared as we thought we was going to be. So during the back end of 2017 and 2018, the Middle East started to talk more about business continuity planning. We did it as a centralized in our leadership team, but we also brought in-house security experts in to help develop the plan, but it was never fully tested. And then towards the back end of 2018, our global business also decided to issue a directive and said, from now on, the whole business needs to have it. Now, as a Middle East business, we had already done some work. So we were in the middle. Some regions didn't have any business continuity plan. We had a draft plan that hadn't been tested, and some of our regions had a highly comprehensive plan. So that was when Group initiated this 3-team approach to business continuity. So at the top, we have the global team, which is the gold team. So this is our global business. They're the ones that set the frameworks, set the strategic direction, and mandate what needs to be done below. In addition, the gold team would also be the team that gets engaged first if there was a global crisis that couldn't be managed at regional level. The silver plan is the next one, which is the tactical plan, is the regional plan. So that there for us is a Middle East as a region. And in the bronze plan below it, in the bronze team, is then our country. And I talked about the 6 countries that we operate in. Today, I'm primarily going to be talking about the silver team. So as a business, we structure ourselves facing our end markets like property and buildings, transport and infrastructure, and power and water, as opposed to structuring by geographical location. So a lot of our core plan has been set at regional level for that benefit, but different businesses will have different models. But it still needs to make sure that we do have the bronze plan in place, because we need to get that local support, the local knowledge, and some information that we can't get centralized, but also the sentiment on the ground of our employees. So to start with, as we go through that cycle, we did the planning. We pulled together all of our functional leads because we needed to drive that accountability lower in the business. And I'm talking about, you know, IT, HR, communications, our projects team, all of the different functions that we have in our business, and pulled it together and asked them to present our top 10 risks that they could identify in the business. And as well as identifying the risks, we wanted to know mitigation strategies. We wanted to know what their recovery options would look like, but also who the key stakeholders were if that crisis materialized at some point in the future. So then we get on to the primary stage, which is the doing. And again, as I mentioned, this is the biggest part of this plan. So we developed our crisis management plan. We had a global template to use. We pulled together, it was 25 pages long. We pulled together about 100 business risks. We had a core team of around 20 people that we would engage in a crisis. We then had the bronze team, which was the additional country leads that would also support. We rolled out training to those involved, and to make sure that they're aware of their role and responsibilities in a crisis. And we started initiating calls on a quarterly basis. One of the most challenging things is at this stage, you also need to test your plan, and trying to create a pilot scenario and recreate a risk is actually a lot more challenging than it seems, and sitting in a classroom and trying to run it. And certainly that was one of my things that I found quite difficult. So after we produced it, we then went on to check it. As I mentioned to you, we had 100 risks. It was far too big. It was not manageable. It was too complex. Some of the risks were also not material. When you take top 10 risks by functions and you start looking at the lower ones, it's things that we could manage locally. It didn't need to sit in a business continuity plan. And we were really looking for a workable document that was going to allow us to make decisions fast. So we acted on it. We then reduced it down to the top 20 risks for the business. So we chopped out about 80 of our risks and highlighted the key 20 risks. We reduced the core team from 20 down to 4 people. So that includes the CEO, myself, the HR director, and our head of health and safety. We felt that having 20 people to engage in, and we got that out of the pilot, that it was just too many people and that we wasn't going to be able to get the quick enough response by having it. So we reduced it to 4 people. But that doesn't mean that we've disregarded the other 16. What we decided we would do is, in a crisis, we would bring in what functional leads are required at each time. So we would bring them into the business. And this allowed us to make much more effective and timely decisions when we tested it. And more importantly, it reduced the plan to just 8 pages and much more high level. As I talk about, this is a repetitive cycle. Ever since then, we've continued to monitor. WSP has made a number of acquisitions over the last few years. So whenever we make an acquisition, we have to embed them into our crisis management plan straight away. Or if there's new information that comes up, if there's new risks, new people joining the business, or if there's new countries we go into, all of these would enable us to continue to change and adapt and keep our business continuity plan live. And quite simply, it's about being ready at any time from anywhere. So now we come on to COVID. Obviously, we had done a lot of that preparation. We hadn't prepared ourselves, I guess, for such a crisis at that time. And not one of our risks we had identified was to the scale of what we've been through over the last few months. So as a global business, we was engaged from January and February with updates from our Asia business. It's such an advantage being a global business because we got to hear so much information that came out, firsthand, not what stuff we're reading in the news or hearing from other people, real life examples of what is happening on the ground in the regions that were impacted prior to the Middle East. So at that time, during January and February, the Gold team at global level decided that this could warrant a crisis, and therefore they convened the Golden team. This is 9 people, primarily based in our head office. They were issuing out a number of advice and guidance notes to the business to start getting prepared for what might happen. In addition to that, the health and safety local leads that have a fairly joined up, and they meet regularly anyway. They also started having more regular meetings to share information, best practice, and what's happening. So what immediate steps did we do as a Middle East business? Well, the first thing we did was we had to engage our silver team. The Gold team had been convened, and now we needed to do the same for our silver team. So that was the 4 of us. By the middle to the end of February, we knew that this was definitely going to be a Middle East crisis, and it had the potential of being something global as well. So straight away, we stopped all travel. Any business travel had to be approved by the CEO. And we had a number of employees that were outside of the region on business travel, and we got them returned straight away. We asked people to start making their way back to their home country where they go, for the fear of being stuck. Many people we did manage to repatriate. Some people chose not to, and we have still a number of people that are still stranded outside the country as we speak. But by acting fast, we managed to get most of the people back that wanted to get back. We know that in this region, the Middle East governments respond very effectively and very quickly to threats, and that we wasn't going to necessarily get a 2 or 3 week time for when airspace, etc., was going to be closed. So even though we stopped it at the beginning of March, I mean, Emirates, as an example, didn't actually stop until the 27th, but even that was done earlier than they had announced. We also advised our other regions. One of the things we have to do, we have a lot of people that come into the Middle East and work on projects here. So we also had to advise them that they couldn't come to the Middle East without us approving it, because for the fear of them not being able to get back to their home countries. And we did have to stop a number of people coming in. So as a core team, we also needed to look at what functional leads we needed to join us in it. The two we identified right from the beginning was communications and IT. Now remember, we've already got HR and health and safety covered as part of our core team. So we added IT. We knew that there was going to be a big requirement for people working remotely, whether it's from home or in other locations if people are outside the country. We also knew that communication in this is going to be key in terms of how we support the business. We set out an agenda for our crisis management team call, and we set that up for twice a week. Plus, at the beginning, things were moving so quickly, we even had some ad hoc calls as well. We were also constantly liaising with our bronze team leaders in each of the regions who were continuing to feed us up information of what is happening on the ground. So if you take our standard agenda for our crisis management team meetings, we would always start off by looking at what countries' circulars had been issued by the government to see what had been issued. And we have a WhatsApp group and we were sharing things as and when we received circulars. The next was any other information that has come out that may not have come from government circulars. Then we needed to talk about travel, any new travel restrictions. Do we have any employee impacts that we need to look at? And if there's any project impacts for the business. The next section was around our active cases. We did have an increase in our employees testing positive, and we also had a number of contractors test positive on our sites as well, and other stakeholders that we interact with. So we had to continually keep monitoring these numbers. The next part was communications. We always did a section on communications to decide what has happened and what we plan to do over the next few days, and I'm going to cover it later. And then AOB. But out of them meetings, we then took a number of actions. At the beginning, some of these meetings took around an hour to an hour and a half because there was so much to cover. We're currently in a stage where we're down to once a week, and this morning's management meeting lasted just 15 minutes. So it's a real reduction from where we were in March, April and May. So this was how we started to deal with COVID-19 when it first started. And for those that can remember as far back as April, will just remember how quick things were moving, how quick decisions had to get. This really were unprecedented times. And as a leadership, we then needed to go into a management phase of how we're going to manage this going forward. To explain how we did manage it, I'm going to refer back to the WSP strategy, as that's the foundations of what our business has been built off. And to do that, I'm going to talk about the strategic pillars. So WSP have 4 strategic pillars. The first one is our people and our culture. So I'm going to talk about communication again. No one ever said that they've communicated too much in a crisis. We did so much communication, and to talk about that and to do it justice, I'm going to do a separate slide at the end just focused on communications. Now, our IT setup for WSP office staff people was quite easy to move them people to working from home. Most of these people work flexible anyway, and they moved and they started working from home. Unfortunately, that's only about 20% of our employees that are based in a WSP permanent office. Another 40% of our people are based in our clients' offices. So they were not in our control to allow them to work from home. So we had to work with our clients. We had to discuss shift patterns. We had to talk about whether we could work from home. We had to agree on under what conditions and on what timeframes. But one of the most important things we had to do was make sure that we could continue delivering our projects from wherever we were located, and ultimately continue being paid for the service that we are delivering to our clients. This group of people, where primarily started working from home, was a bit harder to control because we had started our office-based people working at home slightly earlier. So by the time we got to moving our client-based people to home in agreement with our clients, a lot of the curfews were already in place. So in terms of administering IT kit and getting people back and home, making sure that people could collect it safely, just took a bit of effort to make sure. But fortunately, we managed to get everyone set up from home. The other 40% of our people are based on construction sites, and unfortunately just do not have the ability to work from home on the construction we're supervising, given that it was nominated as a key sector in all of our regions and we needed to continue delivering our projects. So all we could do on that was try and work as flexible as possible. And again, I'm going to cover a slide later about some of the things we implemented on our construction sites to keep not just our employees, but all of the people that visit these sites safe. So if we go back to the people that are now working from home, we obviously had to provide a lot of flexibility for these people. We all know that the schools closed down at the same time, and therefore a lot of people had children at home that they wasn't expecting. They're now doing homeschooling. I think we've all been on calls before where somebody's dog or child has come in on the background, and we need to accept that, this is not, whilst it's not ideal, we have to be tolerant to what's happening. We also did a really big focus on mental health. We did weekly webinars by external professionals about getting people, because it was about having a healthy work-life balance, which is extremely difficult when you're spending 24 hours a day at home. Even personally, I felt isolated from a typical day, which for me would involve lots of traveling. It would involve flying. It would involve lots of face-to-face meetings. So for me to go that quickly into being at home definitely, had an impact on me personally. There's other ways you can also help people feel connected. I'm sure people have done Zoom quizzes. We can do social gatherings. You can do breakfast meetings. You don't always have to have it about work. So we tried to do a lot of that as well. But at the same time, not forgetting that we needed an extra focus on those people that were still on our construction site and having a higher exposure each day than the people at home. Next, I'm going to talk about our clients. Our clients are at the heart of our strategy. Without our clients, we do not exist as a business. We work in both the private and public sector. Two very different client types, very different needs, very different cultures. So there was no one-cap-fits-all approach to dealing with our clients. We had to find new ways of communicating with our clients, but also at the same time giving them confidence that we are delivering. We also shared our guidance internally of trying to show them what we're doing, what approaches we're taking to provide them the assurance that they needed. Some clients asked us to provide a communication of what is our crisis plan, what is our business continuity management. Now, fortunately, we had these plans in place and we could communicate with our clients what we did. And it was accepted. And the feedback from talking to our clients is actually that many of our projects, we had more daily interactions with our clients than we actually would have done if we were in the office, which was a real advantage to us as a business. We also had to adapt to find new ways of supervising our construction sites, whether that's doing visits during breaks, when people are in the canteen, whether that's using technology, but we had to do a lot of different ways to make sure that our sites were safe. Our third pillar is operational excellence, and this is about us being a stronger organization. The first thing I want to raise under this is ethics. We needed to have a continued focus on our ethics and compliance work that we do in the region. We know that some people will use opportunities like a crisis as an opportunity for unethical behavior. So we needed to make sure that we continue to talk and monitor the compliance in the business. Now, we had a good IT infrastructure in place, and one that we felt was resilient, and we had worked on that over the last number of years. What we hadn't expected was we had tested it up to 25% of our employees working at home, and then very quickly we was at 50%. And the IT infrastructure, not just regionally, but globally, could not cope with that. So we had to quickly procure new licenses. We added an extra internet line, and fortunately that was done quite quickly, so we could recover that fairly quickly, so the impact was minimal. I'm sure everyone's seen the increase of Microsoft Teams, Office 365, and Zoom as tools going forward. All of this is just to ensure we can operate efficiently and effectively. Now, one of our mitigation risks is actually about using India. We do some design in India as part of our operational strategy. And we always felt that if we had a crisis in the Middle East, that's fine. We could send more work to India, offshoring, and we could continue delivering to our clients. Now, in India, there's a very much an office-based culture, not really the same number of working from home as we would have in some of the other regions. Now, fortunately, India was slightly behind the Middle East in terms of cases and impact of COVID, which allowed us to start preparing, because we knew that it was going to follow into India soon, and we had a big impact if our teams, not just in the Middle East, but in India, could not work from home. We managed to get to a position that by the time India closed, we managed to get 90% of our people working from home with about 80% productivity. This obviously has improved since, but this was one of the risks that we challenged and how we overcame it. Our final pillar is our expertise. Now, this doesn't really change in terms of our expertise. It's about us building upon what we have, adapting to new environments. You know, we try to demonstrate using our expertise that we could continue to bring value to our clients, certainly in these complex circumstances. This expertise pillar is more about, for me, what we're going to be doing post-COVID. This is about areas we want to invest in, areas we want to divest, and any other new sectors or services or countries we want to go into. So, for example, our focus on aviation may well be different from what it was pre-COVID. If you look at commercial, hospitality, and then you take each region individually, we are going to have to sit back and start looking not just in our countries or our regions, but globally, as to what our expertise is at the moment and what it's going to look like over the coming years. And is it that we start looking into working on more revenue generating assets like oil and gas as an example, but without forgetting about what is our client strategies. Does that change after COVID? What do the countries want to do? What are the governments announcing? So we do rely on that as well, but all this is, as I said, is to be considered when we go into the long-term post-COVID view. So where are we now? I mean, we're starting to get back to normal. We've seen a significant decrease in our cases, both employee and across our sites. We've returned to our offices. I'm in our Dubai office today. We've done it on a voluntary basis and obviously at reduced capacity. It has helped a number of people that could not work from home. We are still limiting our face-to-face meetings, and we've stopped people moving around our construction sites. You can't go to multiple sites for the fear that there could be some cross-contamination if one person gets tested positive. So we've restricted that. In addition, as part of the leadership team, we have restricted our leadership team to having no more than 4 people in an office at once. No different to how it would be flying to another location. We're also in the testing stage of a self-assessment mobile app, which will allow us to confirm each day whether we're safe to visit an office, and we hope to roll that out over the next couple of weeks. So, as I said, this is some of the stuff we've done at WSP to help deal with COVID. The next topic I want to cover is communications. As I mentioned a couple of times, communications is key on this. The first thing we did was set up an internal intranet page where we held all the information, and anything I cover now has all been replicated in this site as a one-stop shop of all the information we need, whether that be local doctors, what to do, what the symptoms are. All of this information was held so that every single one of our employees could access this quickly. Our CEO was doing regular webinars, which allowed us to do Q&A sessions like today. Sometimes it was more appropriate for him to do a video and send a video out, and other times he was sending emails out to all of our employees. Our leadership team typically meets once a month. We increased that to a once a week meeting so that we could really understand what was happening and what the business impact was. Next was our clients. We talked about our communication with our clients. We needed to give our people on the projects the information so that they could provide the assurances and give our clients the advice that's needed on what we're doing to support them in this time. Another one of the great initiatives that was done was these focus groups. So each week we took 10 people, the same 10 people from each country, and they were a mix of people from project sites to people working from home to shared services. There was a people that spread across all the different grades in the business. We did these focus groups to keep the engagement up, and it was attended by our CEO and HR director. And each week there would be a number of questions and topics that we'd want to discuss so we could get real-time information back from the business. And in fact, many of the things we implemented came out of the focus groups. So it was definitely a good initiative that was run. Next, we did some project check-ins. So, using Zoom, webinar, we kept bringing our project teams in and started talking to them. And as I talked about, did an extra focus on construction activities, which we're going to cover again shortly. One of the things we've learned during the last couple of downturns in the Middle East is people want to hear about project wins and successes. They don't just want to hear about what's happening and COVID and bad news. So we made an extra effort, and we continue to do so, that even during COVID, we were still securing new projects in various places. So we did a lot to celebrate, and we started sending out weekly communications of the projects that we had won. Health and well-being tips, working from home, all of this stuff is just to make people be more prepared for what they are. And these are some of the things I covered. And then leading on to the final topic is about our construction sites. We also issued some clear guidance on our construction sites of how we want our construction sites to work to be safe during COVID. So what did we do on our sites? So by early April, we had to help the sector continue to operate during this time. As I mentioned, it was a key sector that we were told to continue. So we put in place a number of measures in early April. Now, some of the measures you see might be standard on some sites now, but a lot of these were before the government had actually, many governments had mandated these. We needed to get our measures in place as early as possible to reduce our exposure. And on the right-hand side, you can see that we implemented a daily login of movement and tracking sheet. This was a contact tracing sheet, which allowed us to, if somebody tested positive or potentially tested positive, we could quickly identify who the people were that we needed to self-isolate and wait for the test results to come back. And that was implemented not just across our sites, but actually was implemented by many of our clients and contractors on other sites as well. We need, because a lot of our clients and partners and contractors were looking to us to help support them in this. We worked with the contractors on developing their own plans. Every project site is different, so we had to work on a unique basis for that. And we run regular awareness sessions. Some of them were face-to-face on projects, but with social distancing. But where possible, we would do it through videos or through live webinars. And the other thing we've realized over the last few years is that on construction sites, it's better to give visual standards to people, not just explaining to people what we want them to do. So we created a big picture list of visual standards of how we wanted our sites to manage. So here are a few of the ones that we did. So you can see, first of all, we've got, social distancing in our lifts. We have social distancing on our buses, in the canteens. We have provided additional PPE equipment, particularly when people are out doing inspections. We also did thermal imagery into the majority of our sites, either through this type of technology or as a minimum through the handheld thermometers. And finally, we did a lot of disinfecting of not just the construction sites, but also the client and the engineers' offices as well. So these were a few of the visual standards that we did as a business. So look, to finish off this webinar, I wanted to pick up just a couple of reflections and lessons learned that we did from this process. So we need to communicate factual information. There was so much information that was passed to me that was, I've heard this is going to happen, or information that, you know, sometimes even that they've read on the news or read on social media. We must stick to factual information and look and get the correct information. One, before we distribute it, the last thing we want to do is be distributing things that are not true. But in addition, just making sure we work off the latest information. It's important to keep calm, particularly when making informed and quick decisions. And there were certainly times where there may have been a bit of panic at some of our leadership level, but we have to keep calm when addressing and managing this in the business. Consultation is extremely key, particularly when making decisions. The focus groups that I talked about, without them, we really would not have been able to make some of the correct decisions that we'd made. And communication, as I covered, is something that you have to do constantly over and over again. And then the final reflection was about how our clients responded to it. You know, they have responded to this change that will change the way we work going forward. We will not be going back to how we worked before. We will work with our clients about new and improved ways of working that add more value to the client, and we can deliver a better model, a better service than we currently do. And this is, I think, what we all have to look forward to going forward. So look, thank you for your time today. I hope you've enjoyed listening to some of the insights into WSP pre-COVID, during COVID, and some thoughts about what we do going forward. Just before I pass you back and answer any questions, I just want to personally say a big thank you to all the members of IOSH. As a leader of WSP, we've always relied on our health and safety professionals to not only keep our employees safe, but also to keep the various people that work in our industry. Recent events have reiterated how beneficial IOSH is as a body, and how you as members have really supported not only WSP, not only the industry, but the region as a whole during these times. And because of you, we are definitely a safer place than we would have been. So I will now pass you back to Deepak for questions. So thank you very much for your time today.
Thank you, Anthony. I've got bombarded with questions for you, so I know we have a time limitations. All the participants, please bear with us. If you are not able to answer your questions all posted in, we would definitely be getting back to you. So Anthony, let me start with the question number one. These gold, silver, and bronze are standards terminologies like tier 1, 2, 3, or only for your company?
I believe so. This was how it was communicated out of our global head office. So I think this was something that was initiated by WSP, because the way WSP Global is, WSP actually, we have a lot of empowerment in our regions. So we don't have a lot of command and control from our head office. They empower us as leaders to run our own business under the framework that they do. So therefore, all they wanted to do was set the objectives at the gold level, and then they would pass that down to us to then manage locally. And I would say the majority of the crises going forward, you hope that we could manage at regional level. But yeah, this is something that I believe WSP has implemented.
Thanks. We got one question from Emil. How do you build business resilience and continuity with vendors, suppliers, and contractors?
Yeah, that's a great question. So as part of our onboarding, for if we take suppliers at the moment, we certainly they go through an onboarding process. So if you wanted to be one of our consultants or to work for us, you have to go through. We have to know that you're, you know, ISO certified, that you've got certain standards in place and insurances. So we consider them in our risks as we do. In terms of, and they're a bit easier because typically we're in control of who we can work with as our who we can work with as our suppliers. Now, when it comes to the contractors, it's slightly different, because when we are bidding a project at the design stage, we don't know who that contractor is going to be. That contractor will come out of the tender evaluation. But I must say, the majority of clients now are also insisting on certain standards, and therefore I do believe that most of the clients that we would choose to work with are doing their own due diligence, as we would during the tender applications, to ensure that they are also prepared for business continuity as well. And that we've communicated with them, as I mentioned before, sharing our guidance around COVID, which we share to our contractors, our suppliers, and to our clients.
That's well answered. Now we have a question from Sri Danya Nair. Could you explain how culture is considered as a pillar for crisis management?
Yeah, that's another great question. So if I talk about one element of culture we have in WSP, we don't have management offices. I mean, I'm in a meeting room today. We all sit open plan, hot desking. We've created a very flexible, we work, for those that can, we have, core hours in the middle. So we've also created a culture where our way of working is around a self-service. It's not around, we don't have lots of support for us. So we've always driven a culture of trying to get people to fend for themselves and work for themselves. So actually, for us to be able to adapt in a crisis was much easier. Most people were able to work from home straight away. Most people were able to adapt their working conditions very easily in this. And I would say, the culture we have around our empowering our people to make decisions has definitely helped us respond quite quickly. We've been talking about health and safety for years, and we've embedded that, that as our norm. And as this year, we've had a particular focus on ethics as well. Ethics was an example where it used to be a bit of a taboo subject, and we wanted to change that culture into the business. So what we did was we started all of our leadership meetings and management meetings now with an ethics pause before we do a health and safety pause. And it's things like that that we use to try and change slowly the culture in our business, so that some of the topics that maybe not have been on the agenda before are now just our business as normal. I hope that answers the question a bit.
It did. Okay, now we have a similar. Do you have an employee? This is a question from Anil Kumar. Do you have an employees wellness program in line with this?
Yes, we do. So our HR team. So we do a lot of sessions. In fact, there was one today. So we've had a lot of, we do a lot of through our, let's say, our medical provider. We do they do it every month. They do different wellness activities for us. We also have some hubs on the internet where people can go and find information. And certainly a lot of our medical, particularly over the last few years, has also moved from, physical medical to extending our services to more health and well-being. And when you take a tier 1 provider for your medical, it's amazing how these additional benefits around people's wellness is already done. And we also work with the Lighthouse Group as well as part of the Middle East to help support us. And I think that was one of the, the key risks during COVID that we talked about, which was why we invested in this area with the additional weekly webinars to what we got before.
This is an interesting question, Antony, into health and safety. So this is from Loy Al Noor. What are the disadvantages of remote working on safety behavior?
So a good example is, so we used to do leadership tours. And as one of our objectives, we want to do monthly leadership tours where all of our leadership team go around. That was something that I was very keen on doing and enjoyed doing. Now, whilst we've started doing them remotely, the one thing we do miss is that face-to-face interaction on our sites. And therefore, we have had to do more engagement than we've ever done before, because without it, there is definitely a risk that you could not get the focus of the same. You know, we have to just use technology. We can't just accept that it's too difficult. We can't go to project sites. So we try to, as I say, over communicate to people, over engage with them, and do project check-ins. You know, it's no different to how we do our project audits. Our project audits that we're now using HSE 360s instead of being able to go to site. But as soon as we are able to go back, we want to go back. But that was definitely one of our concerns, that we wanted to ensure that it did not increase our risk of health and safety by not having that presence on site.
Well, now, this is again correlation. All are related with the mental health being.
That's good. It's a great topic at the moment. So it's good to hear people are talking about it.
Indeed, that was our first webinar. We had actually the first meeting which IOSH UAE did was with psychiatrist Dr. Rina Thomas, and it was more or less people are all worried with that. So the question is, what is the effect of mental ill health on employees' performance?
Wow. Well, look, I'm not not being a medical practitioner, but you know, all studies need to show that, you know, people having a healthy work-life balance, people having a positive mental health. So one of the things we've introduced in WSP is the mental health first aiders. So we've now trained up our, I believe we've trained up now around 50, 60 of our employees through professional external coaching to become mental health first aiders. And they are people that can, because it's not always about people being able to come to you with mental health things. Part of it is about you being able to be aware and can identify that. So that's part of the, so one, it gives them a forum to speak to people if they wish, but secondly, it allows us to identify that. You know, we've certainly worked extensively with the Lighthouse Group as well on providing additional support. It's something that people cannot ignore at the moment. And, you know, the talk about people feeling isolated at home. You know, I've talked to many people where, you know, they've been desperate to get back to the office, even in April, because, you know, the conditions they were working in at home, if they didn't have a separate room and they didn't have separate conditions. And we've got to just keep talking about, you know, having breaks, giving people advice, getting away from your desk, trying to get some fresh air wherever possible. It's definitely, it's something that I'm sure, I think all businesses take serious now. And again, like I talked about ethics and a culture, we're trying to create a culture where talking about mental health is not a taboo subject anymore. It's something that we can talk about to our employees, to our clients, and to any stakeholders. So it's a great question. It definitely is.
And it's well answered.
Thank you.
Now, I think this answers most of the mental health related questions I got. 20-30% of the questions are related to mental health and well-being. Now, there is, I know we are running short of time. I got 47 questions more. So let me pause the Q&A sessions, and rest questions which are there, we would definitely revert back.
Yeah, I'm more than happy to answer any questions.
I would be sharing all the questions to Antony. And thank you, Antony. It was really a wonderful session. We really see what differences WSP as an organization has done during the COVID and how supporting the stakeholders. There were some questions about how it works with stakeholders. Definitely, as I work with one of the projects of WSP, you know, the efforts being taken. And as a chair, I would extend my thanks to the great presentation which you have given to us. And many questions they were asking, where will we get the webinar? Yes, this will be recorded in IOSH website. Records will be posted in IOSH websites, and the presentation would be uploaded in our microsite. Thank you all for attending the webinar. Thank you, Antony.
Thank you all. Thanks a lot. Thanks for having me today. Thanks, Deepak. Thank you.